Okay, so tell me about why you picked the major that you did.
My major is pre-occupational therapy, and I
Mhm.
want to work with people who have special needs. And the reason that I chose that was because a few years ago I got the opportunity to volunteer at this camp for kids who have special needs. And so just being in that environment and getting to know all the campers who each have a different diagnosis was just really cool, and just really opened my eyes to how much I love that population and like wanting to work with them. And I just really wanted to have the opportunity to work on rehabilitation and just be able to help improve their quality of life in every aspect, physical and cognitive, social functioning, and all of that. So,
Okay. Did you work with any specific people at the camp?
yeah, one of my campers had a diagnosis of trisomy 1, which is a lot like Down syndrome. It was a different chromosome. She had an extra chromosome. And so she had issues with, she had physical disabilities and intellectual disabilities. And so that was really cool to just get to see how she lives everyday life and get to be a part of that and kind of the adaptations that she lives with. And so it's really cool to see that and get to learn about it now and how I could help that in the future, help someone else with a similar diagnosis.
Great, that's awesome. So do you want to work at a camp setting or?
I have thought about it, but I think now I'm leaning towards something just more clinical. I don't know if I'm really leaning more towards kids or just a general population, because they're a lot of fun to work with, and like that's kind of where my heart is, but I think I'd be happy either way. But I think I'm leaning more towards a clinical setting.
Okay. Have you worked with any other like people in your field as an OT, like practicing?
A little bit. I talked to one girl at the camp who that was her major. She was going into occupational therapy, and that's where I kind of learned about it and realized that this is what I wanted to do. But also, I took a class with one therapist where we have a patient and we got to work with them in an aquatics lab. And so it was just like one day a week, and we were in the pool with them. And so she taught us a lot about writing goals and treatment plans and just how to work with patients of any type, really. And so I learned a lot from her just about how to work with people and documentation and assessments and like that kind of stuff. So that was like really beneficial just to kind of get a feel for what I'd be doing.
Yeah.
And then we also had a conference recently where I got to talk to a lot of other therapists around the state, and just all these different classes. They talked about what they do just kind of in their everyday job, and that was kind of interesting. Like, you can do all sorts of things in occupational therapy, so it was interesting to see the kind of treatments and interventions that they get to do. It's a good learning experience.
What are the other like field options in OT? Because there's a lot of different things that you can do, right?
Yeah, there's a lot of things. There's a lot of majors that you can go into if you want to work with people who have special needs. One of them, my bachelor's degree is actually in recreation therapy, and then I'm going into occupational therapy. But both are really good majors if you want to work with people who have special needs. There's all sorts of things that go into occupational or recreation therapy. Like, you can be a music therapist, you can be an aquatics therapist, and even stuff like horseback riding and being having a profession in that. So there's lots of different kind of pockets of therapies that you can use, and you can specialize in those. So I'm not sure if I'm going to like specialize in anything or just kind of work in the general realm of occupational therapy. But yeah, there's a lot of different specific things that you can use for interventions that you can become specialized in. So
that's awesome. So it's kind of like with doctors, how they can get specialized or they can just do general.
Yeah, it's all like that. So
that's awesome. So what do most people in recreational therapy go into OT? Or
there's a lot of people. Yeah, it's probably about half and half. Another option is physical therapy, but that's a little bit different. But yeah, it's a lot of the same things, but you find a lot more in recreation therapy, people who have specialties in like horseback riding or outdoors sort of things, and you'll typically find more occupational therapists working in a clinical setting.
Okay. What's the difference between physical therapy and occupational therapy?
Physical therapy is going to be a lot more working solely with the physical aspect of things. Occupational will have to do with physical a lot of the time, but it can also be cognitive functioning, but it's also going to focus a lot more on, can you do your everyday living activities? Can you get dressed in the morning? Can you brush your teeth? Can you get to your car, or just find a way to get to work, or to do what you need to do during the day? Just seeing that you have the means to function every day.